Hello, I am Emily Watts, Domiciliary Care Policy Lead at QCS. It's hard to believe that we are already a month into the long dark evenings and the true onset of winter as the weather begins to invariably change. We were also given hope through the COP26 summit at the beginning of November, which looked at tackling climate change head-on. Weather ultimately has effects on everyone, and it's important that we don't lose sight of that. With this in mind, we have chosen the Adverse Weather Policy and Procedure as this month's Policy of the Month. The policy highlights the need for winter preparedness by reviewing and updating business continuity plans to ensure any weather-related issues are documented and procedures are ultimately put in place to deal with them. Staff responsibilities during adverse weather are also clearly documented within this policy to ensure that continuity of care is not compromised wherever possible. Be sure to have a look at this policy, which is highlighted on your dashboard. We have also continued to see over the last month more developments related to COVID-19 across all regions of the UK, and as a result have continued to update our policies and resources to reflect any changes that might have occurred. In England, flexibility within the COVID-19 booster vaccination programme was announced, with those at highest risk allowed to be given the booster vaccine early, where it makes operational sense. As a result, this could mean care home residents who were vaccinated at different times may be allowed to have the booster in one session as long as it's been 5 months since their second dose. To reflect these changes, our vaccination and immunisation policies and procedures have been updated on the system. For the care home sector specifically, the new mandatory COVID-19 vaccination regulations came into force on the 11th of November. Our COVID-19 visitors tracker on the QCS management system has been updated to display vaccination information in line with the requirements, so please take a look through the settings area of the QCS system. Consultations for the rest of the health and social care sector have now closed, and it has been announced that all staff who work in health and social care settings regulated by CQC will have to be fully vaccinated by the 1st of April 2022. Please visit the QCS management system for policies and resources to support with this. Round 3 of the Adult Social Care Infection Control and Testing Fund was also introduced to extend funding until the 31st of March 2022. Our summary document details the key aspects of the fund and can be found within the Resource Centre. For Wales, a new COVID-19 recovery fund was announced with a £48 million package of support available. In addition, self-isolation rules changed at the end of October. When someone in your household has coronavirus symptoms or test positives, you are required to self-isolate. Fully vaccinated people should also isolate until they receive a negative PCR test. Health and social care staff must also follow some additional guidelines which have been updated in the Coronavirus Policy and Procedure and COVID-19 Testing Policy and Procedure, so please take a look. In Scotland, home working has been advised where possible to prevent the transmission of COVID-19. The country remains beyond alert level 0. As always, we will of course continue to update our resources and policies as guidelines change across all regions in relation to COVID-19. Some further content highlights from this month include: a new policy has been released to the system over the last month called Supporting Bariatric Care Policy and Procedure. The focus of the policy is to support staff who may be required to help service users classed as bariatric. A risk assessment is also included within the policy that should be completed prior to admitting the person to the service. The latest health and safety podcast from NatFans on preventing slips, trips and falls is available on the QCS management system. The podcast focuses on the hazards that can be encountered this time of year that might cause slips, trips and falls and how to mitigate against them. There are also some useful COVID-19 tips as a reminder to continue to ensure your service is COVID-19 safe. A selection of new blogs has also been added over the last month, including a piece on supporting care providers to navigate the energy crisis and how can care providers improve their access to insurance cover. Both focus in on hot topics that might be affecting care providers right now and provide some useful tips to support in these areas. Over the last few months, we have been busy working on our job description templates to ensure they meet the needs of our customers. The new job description templates are now ready and have taken on board customer feedback to make the document more user-friendly and easier to customise. As of this month, all job descriptions will now be housed in the Resource Centre within the new template under the Human Resources section. All old job description templates will be archived from the system. To support this project, a new job description guidance document has also been created and includes tips to follow when creating role-specific job descriptions. This can be viewed in the Policy Centre. If you missed last month's Right to Work Checks webinar, a free catch-up can be found within the Resource Centre. The webinar homed in on what providers need to know to prevent illegal working within their business and how to conduct Right to Work checks. That is all for this month's highlights. Please keep logging onto your system for updates, and please let us know what you think of any of our content via our Facebook groups. From everyone at QCS, have a lovely Christmas and a Happy New Year.